At the age of 2, my brother was diagnosed with leukemia, which is cancer in the blood. My brother was lucky. He was cancer-free by the age of 4 and has been in remission ever since. But, as we all know, not everyone is as lucky. Most of us would give up almost anything if it would lead to a cure for any and all cancers, but we are not quite there yet. However, you can still make a huge and helpful difference in a patient fighting some types of blood cancer. Here's how. According to Health Resources and Service Administration, 17,000 people are in need of a bone marrow transplant every year. Of those 17,000 people, only 30% will find a match in their family. That leaves 12,000 patients in need of a match every year. Matches are more common from someone of the same ancestors. Therefore, there is a need for more diverse donors. Just look at these statistics. The likelihood of finding a match for white patients is at 93%. It drops down to 82% for American Indian and Alaska Natives, 73% for Asian and Pacific Islanders, 72% for Hispanic or Latinos, and 66% for African American patients. If you are older than 18 and are relatively healthy, you can sign up to be a donor. Before we go into how to become a bone marrow donor, let's go into the science behind it all. Bone marrow is a jelly-like tissue located in the middle of large bones, such as your hip bone. Patients that are battling a type of cancer in the blood or are undergoing chemotherapy may experience damage to their bone marrow. If a match seems to appear, you will go under further testing to make sure that the match is good, as well as to make sure you are healthy enough and prepared for the procedure. If the donation is approved, there will be one of 2 ways you will donate, depending on what's best for the patient. The first one requires a 2-night stay at a hospital. You will be given anesthetic before the cells are extracted from the pelvic bone with a syringe and a needle. The cells replace themselves within 21 days. The second method requires 5-day dosage of a drug to ramp up your growth of your cells. 5 days later, the cells are collected much like blood donations. It will last about 5 hours. In the following days, you may experience some soreness, fatigue, and flu-like symptoms, but will recover from these symptoms after 10 days. After hearing the facts, some people may decide that bone marrow donation is not for them, whether that's because of the time commitment or the pain. Others may still be interested. Either way, you can still help. For those who are interested in becoming a bone marrow donor, go to bethematch.org to get a swab kit. Once it arrives in your mailbox, just swab the inside of your cheeks and send it back. You can be called to donate in a few months, in a few years, or possibly never, but joining the registry gives hope to patients of finding a match. In any case, you will never be charged a thing, even if your donation will require you to travel. For those who do not want to donate but still want to help, you can give to the organization to pay for donors' expenses, volunteer, or simply spread the message to help more people become potential donors. No matter what your stance is on bone marrow donations, please visit bethematch.org to find out more information, especially in other ways that you can help.